purpose of the Healthy Borough programme is actually to pilot innovative approaches to addressing obesity in children and families.
And really we've been working at three levels. We've been working at a strategic level, changing the way the local authority thinks about health and integrating health into its planning. And then we've been looking at the provision of food, either in the workplace, in schools, in businesses. And we've been looking at healthy food through the community. And that really is what makes the whole systems approach to tackling healthy food.
I think it's important for all boroughs to make sure that their planning strategies adequately incorporate health. The local development framework is a suite of documents that actually lays out how Tower Hamlets will be developed over the next 20 years. And it's very important that we got all the key health issues into that document.
We have a shortage of open spaces within the borough. We only have about 1.12 hectares per 1,000 population. The green grid is not only about the open spaces or reducing the levels of obesity. It has a wonderful effect on the climate change, for example. It improves upon the levels of obesity. It also reduces the carbon levels within the city. The green grid attacks these problems in a much more effective manner than any other project.
The actual underlying causes of obesity are in the wider physical, social, cultural and economic environments. Policy recommendations were first of all that early intervention is better than treating the problem when it's developed, that we should be looking at the environment and creating environments that support walking and cycling, because actually we've seen a massive decline in levels of physical activity. Nowadays, particularly in somewhere like Tower Hamlets, we have a proliferation of fast food outlets, we have convenience foods which are very high in calories. Finally, working with organisations where you have more opportunity for affecting the drivers of obesity.
So we've been trying to increase access to healthy food through fresh fruit and vegetables, through school meals, through workplaces. And we've got community groups coming up with their own solutions and writing their own recipe books.
Part of the sort of national Healthy Town pilot here in Tower Hamlets, and it's provided the opportunity really to do more of this kind of support. And of course it also fits in really well with other agendas like environmental sustainability, improving air quality, and addressing some of those issues. And we've been really trying to sort of come at it from, I guess, on sort of three levels really. And the first of those is obviously recognising we actually need to sort of improve the infrastructure to enable them to do that. But we've seen that we also need to invest in supporting people to help them to get out there and do more cycling and walking. And we're doing that through schemes that offer training, sort of mentoring support, buddying up with other people who are more experienced and that kind of thing. And the third level really is around working with organisations and encouraging them to promote and to really to sort of embed more active travel approaches in their work plan.
Right from the outset, we developed a community engagement strategy which had three key objectives, which were developing community ownership and community leadership, involving the diverse communities in Tower Hamlet to ensure that we would reach all of them and that the program was making a difference, and to ensure community involvement and participation so that community engagement was embedded within the different projects.
Alton and I worked together visiting the businesses and helped them with advice on healthy catering. Most of the time we found that the businesses were very receptive and very interested and wanted to make their communities healthier.
The food business operator here introduced fruit and vegetables, also introduced oily fish. They've started to do a smoked salmon here now. And then the clever thing that they introduced was a healthy lunchbox.
Tower Hamlets Council introduces a Food for Health award, and then I go to the training program, and then from there I get idea that we can introduce some healthy lunchbox, then competitive price, then we can beat the chicken and chip shops and other stuffs. It's very popular at the moment. The competitive price is £2. Where that people are going to go to chicken and chips for $1.99.
The Borough scheme encourages convenience stores to increase their sales of fruit and veg, and with some stores we've actually got them starting to sell fruit and veg. And also what this project's been very good at is targeting the independent stores that are sort of seeded away in the middle of estates and relative food deserts. So we're adding another 12 to London just from our efforts here in Tower Hamlets. So it has got the interest of the Department of Health, and after that it will be up to local areas to take this forward.
We've worked very closely with the shop. They've been very welcoming. They've set up a very good display, as you can see, and we also worked quite closely getting the links between the schools, the primary school and actually the shop, and they've been very good at supplying the local primary school, which is Christchurch School, and we supply them with subsidised fruit and vegetables on a weekly basis. So people are now recognising the Change for Life logo.
Now his selling is very good, better before is without this poster.
So we've been running a number of active travel projects in the borough, trying to increase the number of people walking and cycling on a regular basis and really trying to build that into their daily lives, and that's a really important aspect of our programme with the various health impacts that comes with that. And we know that something like 40% of people that come along to that training actually end up cycling a lot more after the cycle training than beforehand, so that's been a really useful scheme.
The starting point in Tower Hamlets, particularly at the beginning of the Healthy Borough programme, was that actually we were a borough where the levels of walking and cycling, which we call active travel, were relatively low. And that's particularly the case with some of our ethnic minority communities. Hardly any cycling going on in some of those communities. So we really wanted to set ourselves a sort of ambition of a target, or really around sort of looking at ways that we could increase the levels of participation in some of those communities, and that's really one of the sort of driving forces behind the work that we've been doing.
On the walking side, we've now developed a network of health walks across the borough. These walks allow people to walk at a brisk level, which is important for health, and they've again attracted a lot of people to come along to those and really build the amount of cycling that they're doing.
A major part was really working with the community and voluntary sector in Tower Hamlets and to develop a program which would enable them to take their own ideas on how to eat healthier or be more physically active.
The Can Do grants are a Healthy Borough programme initiative. The aim was to give people a small grant of up to £500 for them to set up an initiative which they believe their community needs. They've realised that they have the ability to set up projects, to manage projects. They have really good financial skills. These are all things that maybe they do in their everyday life, within their family, just for their own personal self, but didn't realise how transferable those skills were.
It's extremely important that this approach is based on partnership, because health services as such are only a small, they're only one of many influences on people's health.
So the environmental health officers have this massive reach across the borough, and they've done something like 600 visits. And the public health dietitians are really good on testing food for the health content, doing the training and doing the evaluation, because they're trained in that sort of approach. So that partnership is fantastic.
We are working together. We have to work together to deliver the greenery in the open spaces within the borough. And this cannot be done by one single department. It has to be done by all of us together.
And I think the really big thing is that is now being really carefully measured. There's all sorts of tools which are available. There's evaluation and monitoring tools which are there and which show the effectiveness of these programmes.
So I think it's a real achievement that we were able to push this further and that we can continue it in the future.
Most importantly, it's about having community-led and community leadership around food solutions. And so lots of mini transformations happening right across the borough, where a particular community, like a women's group or a particular shop or a particular school, can decide their own solution for what's needed at their local level and for their local community. And that's probably the most sustainable solution in the longer term, because it's creating a community awareness and a consumer awareness.
The idea is to sort of build on the momentum from this year, not let it go. in order that the issues are still out there with food businesses so that they can continue with the good work.
How just making such a small change, such as changing the oil, which doesn't have to cost any more, in fact sometimes can cost less, but can make the hugest difference in terms of heart health. For example, changing from an oil high in saturated fat to one that's low in saturated fat. And if you consider that some of our businesses, they have anywhere between 300 covers a day to 7,000 covers a day, you only have to encourage maybe 10, 20 businesses and you have a huge impact. I think it's more of a challenge actually persuading the public than it is persuading our food businesses a lot of the time. So things like this behind the scenes, and I think we'd like to thank our food businesses in Tower Hamlets.
And sort of going forward, it will really help us when we do the more detailed plans of how individual applications are considered.
I think what it's also done is it's allowed an opportunity for some of the expertise within the NHS and the public health sector to come into the active travel field. And one of the main things that that's led to is really robust evaluation of our projects. So we've been able to say very clearly, this is what's worked, this is what perhaps has worked less well. And again, we've then been able to take that forward into our future programmes to say we can deliver cost-effective, value for money, effective schemes which get more people walking and cycling more often.
And we believe that the kind of experience that we've gained through delivering the Healthy Borough programme is going to put this borough in a really good position in terms of sort of understanding some of the ways in which local authority services can help with the health improvement outcomes.
Because a lot of this work is quite innovative and new, we would draw on the evidence base where it's available, but there are areas where the evidence base isn't available, so in those areas we need to be innovative, based our approach on the available research and build in very strong evaluation. We will keep the concept of becoming a healthy borough as a banner. We will broaden it out, particularly to include things like mental health issues and other issues that are affected by the same drivers, and it will be a kind of platform that we can continue to build our partnership work on. As our Chief Executive in Tower Hamlets said recently, the original reason for setting up local authorities was actually around public health, and they're really potentially the whole organisation should be a public health organisation. So by bringing public health back home into the local authority, we potentially can have more impact, but we will only achieve that impact if we work in a strategic way across the whole organisation and not in a narrow way that just looks at one aspect.